During pregnancy and even postpartum, women need to have some increased knowledge over the pelvic floor. A lot of women know the term Kegels. That is like all the science of pelvic floor strengthening, pretty much from 1950, I would say, until maybe the 80s. I have my patients who say, I don't know what's wrong, I do my Kegels.
Yeah.
If they're doing the thing, why doesn't it create lasting effect?
Okay, welcome to the Alive and Well podcast, where my hope is you will find true, long-lasting transformation from the inside out while I talk with others who want the same for you. Today we have a special guest, Esther Spence. She is a physical therapist. She's been working at an outpatient physical therapy clinic for about 16 years, and she does have her own hustle. It's called the Connected Core. She's an entrepreneur. She's a wife. She's a mother. She's a sister. She's a friend. But she has a heart to serve and bring more self-awareness to our physical, mental, and spiritual health and wellness. Thank you for joining me, Esther. Let's just kind of get into it. Tell us a little bit about yourself. What was it like for young Esther in the household? What was your parents like? Tell us a little about it.
Sure. So I grew up with my mom and dad and my younger brother. He's about a year and a half younger. And we didn't have a lot of family, like extended family close by, but we would do a lot of family trips to go visit family around the country. And then we had a lot of close relationships in our church family. So that was always a really fun way to kind of have an extended family through church. So
When you were growing up, did you play sports? What are your sports interests today?
Yeah, love that kind of stuff today. Love Pilates, love yoga. Volleyball. I've coached some volleyball. I have 3 daughters. My husband and I have 3 daughters, so we get to watch them play and just love that.
You're a busy mom.
Love it.
When you were growing up, did you have a culture in your family about physical health, about mental health, and then more importantly about spiritual health?
We did. Yeah, so physically we were very active, and I think we didn't realize it. You know what I mean? It was just the norm to be active. My brother and I would just ride bikes. That's like what we did. We would just always be going somewhere, doing something, climbing trees, playing with our neighborhood friends. And then even as a family, we would walk a lot when we went to the beach. We wouldn't just be the family just camped out on the beach. We would just be in the water or enjoy just playing. So that was a pretty strong thing that I love doing, was just being active. And then you asked about mental health.
Yeah,
right?
Did you guys talk about that kind of stuff growing up?
Yeah, so my parents were both, my dad was a guidance counselor, so he worked at a middle school, so he was always interested in, discussing deeper things, with us as kids and even growing up. And then my mom is a social worker, so she has a heart for, really getting into the mental health aspect of things as well. So grew up, being counseled by my parents, which was great. They were very supportive for my brother and I. And then spiritually, we were raised just to love God and love others. And I think that really impacted my worldview, just even in, how I think about other people and even a career choice, with being a physical therapist, I get to love others well through a career.
Yeah. Yeah. No, I like that a lot. And I guess in our field, you have to really care about people because you're with them a lot.
Right.
And if you don't like people, then it's probably not a good career.
Probably not a good fit. Yeah.
Let's get into a little bit of like your deal as a therapist.
Okay.
You've been working for 16 years. You got a lot of experience.
I do. Yeah.
And sometimes in the therapy world, we listen to podcasts and other people talk, and they're just researchers. And they give a lot of good research advice, but then there's no like practical clinical advice. So let's talk about a little bit about what you do. Would you mind telling us the population you serve and are most interested in these days?
Sure. So I, when I first started out as a PT, loved orthopedics. So I pretty much did orthopedics for the past I would say 12 years for sure, like just plain old, good old orthopedics, which is still wonderful. But then after having 3 daughters and realizing the change that happens to your body after having kids, I really decided that there must be more to healing after, in that postpartum period. And so I started to dive into what wellness looked like as a mom, and really got into even more Pilates and that kind of just whole well-being of the mental and attacking the physical too. But that's what I love to do now, is work with women during pregnancy, right after having a baby, and even after that. So I do a lot of women's health, a lot of pelvic floor health, and just helping with issues that have sometimes occurred because of things that could have been addressed in pregnancy, maybe even postpartum, but then they're just left unfinished and uncompleted, so that they do get worse in our later years.
Yeah. In your field, if somebody doesn't get treated with therapy or some specialized intervention during or after pregnancy, some of the conditions you work with, how is that affecting them long term?
Okay, so if you are pregnant and you deal with maybe some pain or mismanaged pressure, or even some very physical things like incontinence, or just generalized weakness, then you have your baby, your brain is really on that baby, not necessarily on your physical health. And that's where I find a lot of women kind of push things aside and they don't address these issues. And we kind of, our body is really good at compensation. And so we will overwork the back, or we will change the way we breathe to not involve the diaphragm and the belly. And then we'll just grip and protect and guard the pelvic floor. So what I've seen in the older population, and I say older, honestly, it's not even that, it doesn't have to be that much postpartum, where people do have these more chronic problems with that with that chronic tension that lives in these muscles. So long term, they can have problems with incontinence, problems with not managing the pressure in their abdomen well. They can have separation of their abdominal muscles, which really just feels awful because you don't feel like you have any power or any strength to do the things that you once loved, like athletics or even just lifting your kids. And then other problems develop too. There is a statistic that says 60% of all women in their lifetime experience what's called prolapse or pelvic organ prolapse. And that's really sad to me, because I think if we talked about these things more, and if we realized how just kind of handling pressure management better, I keep going back to that, but in learning how to breathe correctly and not bear down to the pelvic floor, we can actually prevent a lot of these really bad situations that can occur.
I kind of want to follow up with a question. I think you might have already kind of just said it, but as you've been practicing for so many years, what do you think is overlooked or not addressed enough in women's health, or maybe in pregnancy, that you're like, this needs to be talked about more? And maybe it's just what you said.
Yeah, I think honestly, just during pregnancy and even postpartum, I think women need to have some increased knowledge over the pelvic floor. So whether that means, yes, coming in for pelvic floor physical therapy, or whether it's just better education from our, OBs. If it were up to me, everybody would come in for a session or 7.
Or 7. Yeah. So as you've been specializing in pelvic health, as a therapist, do you see the younger generation of 30 to 45 caring about their pelvic floor health, about GI health in general? Have you seen a change in that, or not really?
Yeah, for sure. I mean, it wasn't really talked about when I was going through it. So I'm seeing a wave of people in their 20s who maybe even haven't thought about having kids, but they want to come in, just start talking about pelvic health.
Mm-hmm.
And then more women who are pregnant and are not having any real symptoms. They have no pain, no incontinence, but they want to come in because they've heard that it's important. So I love that. I think that's really, really cool. It's prevention, it's preventative health, which I don't feel like our medical world does very well.
Yeah.
But yeah, no, I think there is an increase in the younger population caring about that.
No, that's definitely very, very encouraging.
Yeah.
To know that people are caring. These are some of just questions based on your clinical experience and some things you kind of touched on, and I just kind of want to get some clarity, kind of like thoughts for some of us folks that are just confused out there. Okay. Do you think it's okay to exercise during pregnancy?
Yes, it's very, very okay. In fact, I think it's necessary, unless, of course, your doctor has put you on bed rest. But yes, movement is very, very important.
Cool. So, like, what are some key exercises you might suggest for women who are pregnant to begin maybe doing that could help them?
Okay, so I love a yoga ball. A lot of women know about that for pregnancy, but usually they think about it towards the end, like during labor and things of that sort. But really, if you get a yoga ball and start just sitting on it, it's helpful to release tension. So tension often builds in the pelvic floor and lower core and back during pregnancy. And it creates, so a tense muscle creates fatigue in those muscles, which then actually creates weakness. So long-term effect, obviously, isn't very good. We don't want chronic weak muscles. We want to be able to relax muscles when we're at rest so that we can then engage them and use them when we need them. So yeah, sitting on a yoga ball, circles on the ball, any sort of stretches, low back, hips, keeping moving is really important. And then I always teach diaphragmatic breathing. And I think diaphragmatic breathing is one of the best things you can do during pregnancy. It helps prepare you even for labor. There's a lot of things that I coach my patients in just how to prepare for that.
Yeah. Yeah. Can we touch a little bit on diaphragmatic breathing?
Yeah.
Can you take me through like a lesson?
Sure. So first part of any sort of breathing exercise is you want to address where you're holding tension. So we all do it. We all hold tension somewhere. A lot of people will hold it in their jaw. So pregnancy too. So if you catch yourself and your shoulders are elevated and you're kind of drawn in, you're clenching. For me personally, it's when I'm driving. So I can catch myself if I'm late or if I'm driving in a lot of traffic. I'll just be like this. So automatically, if I catch it, I know that I can release it.
Okay.
And I call it like a domino effect. So if you have this clenched, you know that you're shallow breathing, which, is the opposite of diaphragmatic breathing. So you know you're kind of just taking short, shallow breaths and then creating more tension and problems in the core and pelvic floor. Okay. So all of those kind of domino in a negative way. But if we address the jaw tension when we recognize it, so you can relax your jaw, relax shoulders, then allow for the breath to really be able to extend and lower your diaphragm. So after you release that tension, what you can do, I like to put one hand on the chest, one hand on low belly. And then if you can, think about your whole body cavity expanding like a balloon. So if you imagine blowing up a balloon, all the walls of that balloon will expand equally on all sides. It would be weird if you saw a balloon suck in on one side and draw out the other way while you blew into it. So you want to imagine your whole cavity extending outward. So chest, belly, sides, back, and pelvic floor all extend outward together. Okay. So I think mentally grabbing a hold of that picture and realizing what you expect to happen first, and then releasing that tendency to hold something in right? So whether that's your belly or sides, pelvic floor, all of that just has to release in tension, and then you're able to maximize that good inhale. All right, so once you've done all that, and you're going to take a 4-second inhale through your nose. So that would look like kind of widening everything. And then the exhale would be a similar thing, but you're now drawing up pelvic floor and drawing in your core muscles.
Pause.
And yeah.
How do you draw up your pelvic floor?
Yes, good question. So a lot of women know the term Kegels.
Yeah.
So Dr. Kegel was an OB back in 1950.
The guy's name was Kegel?
Yes.
Oh.
So he invented the Kegel, right?
Yeah.
Named it after himself. And so his training was that contracting a muscle in the pelvic floor would be strengthening. Okay. So that is like all the science of pelvic floor strengthening pretty much from 1950, I would say, until maybe the 80s. I don't know. But in that span, a lot of times people would do their Kegels. And even today, I have my patients who say, I don't know what's wrong. I do my Kegels, right?
Okay.
And so where's the mishap, right? Why, if they're doing the thing, why doesn't it create lasting effects? Or why does it actually worsen the problem? So what the training is to think about closing your rectal opening and then closing vaginal opening and almost like pulling upwards, okay? So when you teach that to a patient, and only say that, right? Can you contract? So
and the patient will get that?
If we did something in PT, right? If you had an exercise where you told a patient that, okay, you're going to do some shoulder work. So we're going to grab this dumbbell and I want you just to hold it, okay? And continue to hold it and continue to hold it, right? After a little bit, they'd look at you like, you're crazy, because their arm would start to shake and maybe they'd have some pain. And then if he's like, okay, that's enough, go ahead and stop. So you'd have them lower the weight down. That might even be difficult for them to fully lengthen their bicep. And then after that, their arm feels really heavy. So it doesn't take long. Maybe, after 10 minutes, they would start to shake, right? So if you're coaching people on a Kegel and you're just saying lift and contract, there's not a lot of guidance on that release. And so people say after pregnancy, after any sort of abdominal surgery, anything that impacts kind of how our canister, we call it, or body cavity works, causes some trauma to the pelvic floor, and we just want to remain tense and tight, right? So if you're taking tight muscle tissue and only contracting it, so you're taking something that's already elevated and
just making it
active and then just making it more tense, you're not actually going to release any of that tension or allow for a good muscle function, which is first release, then contract. And so that's where the error is in the Kegel, is that people just want to constantly contract. And yes, they may get a little release, but it's never a full release addressing that chronic tension.
Okay, so understanding that we might need to actually release the Kegel.
Yep.
How do you release it? Like, how do you because you mentioned earlier, like trying to let your body just kind of, like, how does that work when you're always contracted?
Right. So, and that's where a lot of women have difficulty in this, especially after having a baby, right? So you've gone through the trauma of that, right? Growing the baby, delivering the baby, whether it's C-section or vaginal delivery, both are problematic for the pelvic floor and create that guarding effect, right? So just muscles want to guard and protect, right? So when that happens, there's a disconnect through pregnancy anyway. And so the brain has a difficult time really sending any signals of contract or relax. And so it just does, okay, we're just going to lock it down. We're just going to make it tight, that's going to work for a little while. And it does. And that's why things, maybe don't show up as problems for a while. But after time, that fatigue turns into weakness. And then we have some pelvic floor issues. So your question was, how do we release it? So that's the power of the diaphragmatic breath, right? So the diaphragm under the rib cage actually mirrors the movement of the pelvic floor and vice versa. So if we are shallow chest breathers, right, we are constantly actually picking up the diaphragm, right, in that paradoxical type breath. So we're drawing in belly, lifting chest. So you'll see people's shoulders lift, chest lift on a big inhale, and they're only drawing up pelvic floor, drawing up core. So you want to reverse that. You actually want them to engage in a breath that allows for the diaphragm to lower, which then lets the pelvic floor lengthen.
Okay.
So, all right, so here we go. For our diaphragmatic breathing, we're going to do a 4-second inhale, and we're going to let the body cavity expand, chest, body, or belly, pelvic floor, sides, and back. Okay, so here we go. Inhale for 1, 2, 3, 4, and then exhale. You're going to close pelvic floor first, and I like to make a shh sound. See if you can draw in 3, 4, 5. Good. So 5-second exhale, 4-second inhale. You remember, inhale is that expansion, that lengthening, wide, everything relaxing. And then a purposeful exhale where you're, so the reason why I do kind of more segmentalized exhale is because we're not really aware. We're not really good at knowing what our pelvic floor is doing. So if we only kind of give our brain tunnel vision and we just say, you only do this, and then you only do this. I call it a zip. So think about like a zipper on a jacket. You start low and then you zip up. So as you're doing your diaphragmatic exhale, you want to think about, as your zipper is zipping, you're maintaining that contraction. So you're staying closed as you continue up that zip. And then, it takes practice. There's lots of different ways to do this. Seated is, I would say, medium hard. Laying down flat on your back with knees bent is a little bit easier.
Okay. And then advanced stage would be like what?
With exercise. So you want to be able to do a diaphragmatic breath while you are exercising. So, and that's one thing that I find really helpful in our programming is if we can master it where it's easy. Master it when you're on your back, knees bent, then get to sitting, then get to standing, and then do it while you're picking up your toddler or carrying in something heavy from the garage, that kind of stuff.
Cool. Yeah, thank you for taking us through that. That was very informative. Can we talk about UI? Urinary incontinence.
Yep. Your favorite subject, huh?
So, can you just kind of discuss maybe some general of like what is urinary incontinence and what should women like? What are some signs and symptoms that maybe women are like, do I have it? Do I not? Can you just kind of give us a little brief overview?
Sure. Yeah. So ultimately, any leak is urinary incontinence. So even though I think in our culture we laugh it off and we just kind of make a joke about it, it really is a dysfunction. So nobody ever wants to hear that. But I think that when you recognize that, oh yeah, I am having a little problem here, then it makes you seek out answers, hopefully to prevent it from getting any worse. So how does it happen? It's actually a coordination issue. So just to kind of go off track just for a second, there's a video of a bodybuilder maxing out her PR on her squat, and she is doing a great job. She goes down into that full squat, and what happens is she leaks a lot. Okay, so this is a very strong woman, probably, max of her weight class or whatever you want to call it, and she is still having urinary incontinence. So it's not an issue of her pelvic floor being weak. Her pelvic floor is probably very strong, but it's actually an issue of coordination. So if we don't manage pressure well, so our body is under pressure all of the time, right? That's how even our diaphragm lowering and lifting helps with air coming in and out, okay? So coughing is pressure in the body, right? Yeah. Sneezing, laughing, jumping, all of those are pressures that we need to learn how to manage. And if we don't do that well, so if we have had a baby and we're not really great at communicating mentally to the pelvic floor to activate a contraction during that downward force or downward pressure, then we're not going to be able to withstand that, pressure down and resist the leak. So that's kind of like a big picture view of how incontinence happens. But I think if people understand that you can just manage it or improve it by contracting those muscles, similar to how we did that diaphragmatic exhale through that zipping, a split second before that downward pressure or force comes, then it prevents a leak. Like say you get a tickle in your throat and you're about to cough. A lot of women will cross their legs or just get that panicked look in their eyes, and especially when they're in public, they're like, I do not want to have a leak. And so that desire, that fear actually of a leak is what increases tension even more. And so when that occurs and you just get really like, I will not do it, and then you cough, you've already kind of worn out your pelvic floor with that tension and gripping and all that. And then that cough comes, and then that pressure just can't really be withstood. So how I teach my patients to do it is diaphragmatically inhale just real quick, and then prepare your pelvic floor by closing it, beginning a little exhale, and then you can cough, but you're closed. The way I actually describe this is using a can of biscuits. So, are you ready for this one?
What kind of biscuits? We're talking like the pop can?
Yes. Okay. Yes, you're following. So, if you envision your body under pressure, right? So your body cavity is a system under pressure. So if we are trying to manage that pressure, think about like a can of biscuits. If you wanted to burst your biscuits, what do? Kind of press right on that seam, right? On that weakest area. So what would as people, where would our weakest link be? Well, it's like middle body, so like a diastasis, or pelvic floor. So when we think about that, think about it in that way, we don't want to burst our biscuits. So we'll actually like guard it, protect it, right? By drawing those muscles inward. And then when that pressure comes, we've got, some support for our biscuits.
All right. So every time I eat biscuits now, we think about this. No, I like the analogy. I like the picture. It really helps kind of put it together.
Helps people remember it.
Can we talk about diastasis recti? Did I say that
What
right?
was that?
Diastasis. I could never say this word.
Diastasis.
Isn't that what I said?
Kind of.
Is it actually possible to close the gap?
It is. Yeah. It is possible. People focus a lot on the gap or how many finger widths and all that. And while that is important, I will say more current research is showing that the number of finger widths isn't as necessary. So, our abdominal wall is made up of, we can just say 3 layers, right, of muscles. So the one that we want to focus on first is the one that runs horizontally. So our I almost said diastasis recti. So that transversus abdominis muscle runs long ways. And so what we want to do, the way I describe this is you would not have your favorite meal served to you on a paper towel, right? So it would just kind of fall through. So you don't want to work on your abs. Everything is food related with me. I don't know.
I love these analogies. Those are great.
They just come to me. I don't know. But you don't want your favorite dinner on a paper towel, right? So you have to have that base, which is that deepest layer, strong first. And so one way that we actually work on that is through breath work, diaphragmatic breathing. And it's funny, I have worked with a lot of athletes, very strong athletes, and they hate this stuff because it feels like you're going at a snail's pace, because what we're doing is hard. It is brain training. We're actually mentally connecting those muscles that have been really stretched, and really that connection is so disrupted. So you have to do that work of that mental activation, very purposeful. It's very slow and tedious, but
it sounds like there's a lot of breath work involved with a lot of pelvic health.
There is.
And so in a world that moves very fast, does it seem very counterintuitive to slow down and do breath work? Is that like, do you get a lot of resistance in your patient?
I do. Absolutely. Yeah. yeah, they think that somehow I have, you know, evaluated them in such a way that they are very weak, which in some ways they are, but and they can still do things, like they can still do, and that's where they get caught up is, well, I can still do a pull-up, right? Yes, you have a big bulge in your abdomen, but they're strong,
Right.
like they can do these things. And I never have a list of things like, here's your paper, you are not allowed to do these exercises. I don't really do that. I think as long as you know technique and as long as you can coordinate the muscles appropriately, you can do anything. You can do planks, you can do high power jumps, but you want to be able to draw up appropriately. So it's all about managing pressure. So if you can manage the pressure that's coming and have enough strength of those muscles, then you're golden. So
yeah. Do you think pelvic floor therapy or pelvic floor health should be an interprofessional approach? And in your opinion, who should be on the medical team for the patient?
So someone's needing some assistance in pelvic floor wellness, I think really needs to have their OB/GYN on board for sure. So a lot of my patients do come from their OB/GYN or a urologist. So those two are my primary referral sources. So, the patient feels comfortable bringing up those kinds of situations to those doctors. And that's one thing I want to say too, is don't be afraid of bringing up these issues, because I think in our culture today, we don't actually talk about it. So I do always encourage my patients, hey, you're going through this, your friends are also going through it. So talk to them about it, because they don't know that there is help a lot of times, just because even women, we talk a lot, we talk to our friends, but this is a subject that is pretty taboo and we don't really share this information with people. But I think, like you were saying earlier, that younger generation is becoming more aware and more comfortable with talking about it, which is good.
Yeah.
But, yes, having a healthcare team that supports one another, that is on board with what, everybody is capable of doing and what their strengths are is really important. Where PT comes in there, I think, is we can really do a lot of help, especially if they are having some surgeries, like for a prolapse, for instance, or hysterectomy or things of that sort. Those are major surgeries, and they need to learn how to work those muscles without a lot of downward pressure. Again, focus on the pressure again. But if we can really train the coordination aspect even before surgery, then they usually have better outcome after surgery. But even just, women who are pregnant or postpartum, their general health practitioner obviously should be on board. But yeah, I love being a part of that picture too. I think PT is, a huge aspect to all of that.
Here's a good one. Should men care about their pelvic health?
Definitely. Yes.
Why?
So everybody has a pelvic floor. We all have one. It's literally the floor of our pelvis. So the pelvic floor is made up of the muscles, tendons, ligaments, nerves, everything that is at the base of the pelvis. So if you look just at the pelvis, it is a structure, solid structure, right? But it's got a giant hole at the bottom. And so we need that muscular support, okay? So, and then obviously for our organ function, holds our organs in, right? And just for elimination purposes, sexual function. So all of that every human has. So men can have issues with their prostate, and then sometimes surgery. And so when I have worked with men, it has been after those surgeries. And honestly, everything that we just talked about is the same. So addressing tension, doing diaphragmatic breathing, it's the same. So.
Gotcha. Well, let's go to so just tell us, how can we raise awareness for pelvic floor therapy today? Like, what should our attitude be?
So I think that if we are talking about it more with our friends, not seeing it quite as taboo as it has been in the past, and then also if you're having an issue, talk to your doctor. So that could be, we listed out a few, but it can just be your nurse practitioner that you love. It could be your general practitioner. It doesn't have to be, you don't have to go to the gynecologist for these issues. And then ask for a referral for physical therapy, pelvic floor physical therapy.
And come see Esther Spence.
Come see me.
I want to transition a little bit and talk about a little bit of soul health. Maybe moments or examples where you've tapped into your spiritual or your faith or something that you've like maybe personally said to somebody or encouraged them through a tough time, and then that's really transformed their therapy or their life in that moment.
Yeah, I think ultimately, when I wake up in the morning, one thing that I like to do is acknowledge that I do not have power over my day. And I think that's going back to my mindset over, who I am, what I'm here to do. And ultimately, God is in control. So when I can kind of relate with a patient in that mindset, there is healing there. And I think that kind of, reignites my faith, helps their faith, and then we can move forward again with what we have control over.
Yeah. I just want to ask you these 2 questions and then we'll wrap it up. Is that okay with you?
Perfect.
All right. If you could tell me one thing physically, mentally, and spiritually to practice daily that would help me in my health journey, what would it be?
All right. So physically, I would say diaphragmatic breathing.
Yes.
You knew it was coming.
Breathe.
Yes. But even beyond that, just mobility, right? I think we live in such a world of just stagnant, like sitting postures, slouching, all that. Yeah. But if we can just practice mobility, healthy mobility is really good. Spiritual, I would say, be purposeful, kind of like that morning mindset of, open hands of what do you have for me today? And then mental, I would say just kind of continue to invest in yourself, right? Like find different ways to, like if for me, being a PT, I love figuring out ways that I can increase my knowledge in the world of women's health. So kind of just never be stagnant in that either.
I like it. Sorry. Could you recommend a resource for someone to read, listen, or watch that could help with their soul health?
Yeah, I read The New Morning Mercies by Paul Tripp every morning. And so again, it has a lot, it's helped me with my morning mindset. And it's just really short, 1 page, easy to digest, little excerpts from the day. So I love that book. So New Morning Mercies. Yep.
Perfect. And then last question, can you tell us how we can connect with you if you have any questions about our health, specific to women's health, pregnancy, pelvic floor, anything we talked about today? How can we connect with you, Esther?
So I have an Instagram page. It's called The Connected Core. So that is a really easy way for people to find me. And feel free to send me a message there. I'm also taking clients at the Balance Culture, which is a women's studio, like a fitness studio. So I'm doing exercise coaching there. So if you want, we can always talk about that more specifically through Instagram. And then I'm at Watson Clinic as well. So for pelvic floor physical therapy.
Yeah. So. Esther, I want to thank you for your time. You've definitely given us a lot of great information that with a lot of imagery that I really enjoyed. I think a lot of us are going to think about food whenever we think about pelvic health. But it was great because we'll think about these things more and more, and it'll become more aware, and we're definitely going to reach out to you when we need help. At least I will.
Sweet.
Thanks, Esther.
Thank you. My dog is totally behind you.
That's funny. I gotta get a shot of your dog.
Usually later on, we'll have some I was gonna say prostectomy, but I
I was trying to fill in the words, but I didn't know what you're going to say.
prostate.
Oh.